Nathan Sparks doing a presentation on yellow fever because I believe it's an underestimated virus. I have three audiences, Jessica, my mom, and my dad, and I'll be pointing to the diagram I made briefly during the presentation. Yellow fever is a virus disease carried by female mosquitoes. It usually occurs when a person suffers a bite from a mosquito that has previously bitten an already infected human. You can see the mosquito in the bottom right hand corner, and you can see the microscopic view of the virus at the top left hand. The yellow in the name refers to jaundice, and in medical terms jaundice is the yellowing of the skin, and it affects some patients. Some other names of yellow fever are yellow jacket and black vomit, which black vomit the name came from Britain in the 1800s. And American plague is also another name for it. And by those names you can tell that it is a very serious virus. It's common in South America and South Africa, as you can see on the map in the middle of the darkened areas. Anyone can get yellow fever, but the elderly have a higher risk of severe infection, as well as infants do, because they have a lower immune system and they're more fragile. If a person is bitten by an infected mosquito, symptoms usually develop within 3 to 6 days of the initial bite. It doesn't come on all at once like some viruses do and kills you. It has 3 stages. The first stage is the infection stage, which is the initial bite, the remission period, and the intoxication period, which is a more serious stage of the virus. In the first stage, you can see on the diagram at the bottom, they have headaches, muscle aches, fever, loss of appetite, vomiting, and jaundice, which, like I said, is the yellowing of the skin. And those are all common side effects. Symptoms often go away briefly after about 3 to 4 days of the first stage. The second stage is the remission period. People are in the stage after the 3 to 4 days. The fever and other symptoms go away. Most people recover at this stage, but others may get worse within 24 hours, like the elderly and the infants. The third stage is the intoxication period, which is the more serious stage. In this stage, the multi-organ dysfunction occurs, which is the body shutting itself down and you're basically dying. It includes liver and kidney failure, bleeding disorders, brain dysfunction, seizures, coma, and, like I said, death. And they usually die within 10 to 14 days of the initial bite. Yellow fever is difficult to diagnose for the doctors, especially in the early stages, because it is confused with other diseases, and they can't run just a normal blood test on the person to tell if it is yellow fever. You have to run a certain test to distinguish it. Blood tests can detect it, but like I said, you have to run a certain test. Antibodies produced in response to the infection is shown in the test. Most of the time it is not known until the person passes away, when they do a liver tissue sample on the corpse, and they can't do that when you're living because it is dangerous. They can, but it's dangerous. There's no specific treatment for yellow fever besides supportive care to treat dehydration and fever. It may improve serious ill patients. Since there is no treatment for yellow fever, it is very important to prevent it, and the only prevention for it is the vaccination. It's the single most important measure for preventing yellow fever because it is the only way to prevent it. You can control the outbreaks and epidemics through the immunization. The yellow fever vaccine is safe and affordable. Anybody can buy it. There's no reason they can't, other than they don't want to, or the doctor basically doesn't tell them about it. Providing effective immunity against yellow fever within 1 week, or 95% of those vaccinated. A single dose provides protection for 30 to 35 years, which is basically half a lifespan or more. Side effects are rare with the vaccination, so there's no risk in taking it. Yellow fever is a very serious disease, especially since there is not a cure for it. There's been many books written about it. I have one displayed on the page. It's called The American Plague, wrote by Molly Crosby. They've also done newspaper clippings about it. I have one up in the top right hand. Everyone should be aware of yellow fever, and I believe that doctors should make it a regular vaccinations for their patients.